knee flexion PAILs for neurological tightness. So neurological tightness is simply, as I flex my knee, if I've got a tightness over the front that kind of stops it, it's a bit painful, that's a neurological tightness because it's not a mechanism sort of in the joint. So what we're going to do for that one is we want to get to a position that is as flexed as you can before the pain starts, or just before the pain starts. So you want to get in as far as you can. If it starts to hurt about here, just come out a little bit, and then this is where we're going to do the PAILs contraction. So PAILs is just an isometric contraction using the progressive tissue. This is the progressive tissue because as I flex my knee, this is getting larger, plain and simple. So there's a couple ways you can do this depending on your mobility. I could very easily just do it here. So I could sit up and I could get here. If I can get here actively with my knee and it hurts, but I can get my knee and pull it in further and I can get it here, then this is the position you want to get into. You want to get into the position that you can passively get into before the pain starts. So a couple of things here. One, I've got a yoga strap. If you don't have the mobility, literally just put, I mean, you can use anything here, right? So just put it over there. So you can sit up. It's probably easier just to lay down. Literally pull this until, okay, that's the tightness. So we literally sit here and just hold tight, and then you're going to effectively isometrically load. So you're going to try to straighten the knee, but this isn't going to let it. So imagine this wasn't here, that's what you'd be doing. But we're going to do this. Now we're going to gradually ramp up. We're just going to get up to about 60 to 70% at a maximum intensity, or where it starts to hurt, whichever comes first. So ramp up super, super slow. So I'm holding here, I'm pushing into the strap, and I'm going to start here, just at like really light, like 5%, gradually move up, 10%, 15, 20. If it starts to hurt here, this is where you stop, and just hold this intensity. And you want to get up to 60 to 70% if you can. If you can get up to 60 to 70%, then hold that 60 to 70%. What we're going to do is we're going to try and do this for 2 minutes of accumulated work. So what will happen is the first few times you do this, you're going to go and you're probably going to get to 20 seconds or 10 seconds or 30 seconds, and you'll feel the tissue fatigue, and whatever intensity you were doing, you won't be able to keep it up. So at that point, just relax, stay where you are. Give it 10 seconds, 20, 30 seconds, whatever, however long you feel you need, and then go again. Exactly the same thing. Slowly ramp up, get that intensity, go again. So we want to do 2 minutes. Now, if you could do that for 2 minutes, then that's your rep done. If you do it for 30 seconds each time, then you just do it for 4 times. So you're accumulating 4 minutes worth of work. And what you'll be doing, hopefully over time, over the progression of the sessions and weeks, this will just be coming closer as you start doing it, and you'll be able to generate more intensity as you go. Once you get to a full flexion and you've got 2 minutes and you'll be doing it 60 to 70%, you're ready for the next one, which will just be generating a little bit more force and with some slight different resistance. Now, if you don't have a strap, you can do this against anything. So if you're, let's say, not outside, but let's say you're in your living room, you've got a couch. Probably don't do it against something wood like this, but literally get here, find that maximum flexion you've got here, and this is it. And then so you can just I'm like pushing my foot against here now using my quad. So any sort of immovable object is fine. You don't have to be holding your own leg. I could be doing it against here. I could put my toes against the wall, like whatever. All the objective is find as much flexion as you can, get to that position, isometrically load it, gradually get up to 60 to 70%, or whenever pain kicks in, and go to just before pain and accumulate 2 minutes worth of work. Enjoy.